Hello, and welcome to the My Heart and Mind podcast, where it's all about creating the feel-good mindset so you can make the most of every moment and reap the benefits of getting the most happiness out of life. And now, over to your host, Sally Crawley.
Hello and welcome to episode 10 of the My Heart and Mind podcast. Today I have a conversation with Tena Kennedy. She lives with chronic illnesses and enjoys a good natter. Tena's going to tell us all about her admission into hospital with unstable angina and how that was just the beginning of her story. Tena lives with many cardiac and respiratory chronic diseases, and she shares with us her journey and also her coping mechanisms that help her have a glass half full outlook despite the many changes to her life. She talks with me about her diagnosis and some of the procedures she's undergone, including a TOE. Stay tuned if you want to find out what that is. And explains all about how she needed to get acceptance of using her CPAP machine at night and how scary the thought of it was compared to the reality. She also shares with us her thoughts about honesty with the people that you love, and we talk about fear and how not knowing or understanding can add to worry. We're also going to continue to discuss how you can become confident and that you need to be your own advocate with your medical teams. She shares with us her top tips for making the most of your hospital appointments. Tena also shares with us her top tip for managing your emotions and thoughts. It's about using your voice. How finding people who share similar experiences can help you not only with the medical side, by explaining how it was for them, not giving medical advice, but also about how life is for them and how they live their lives now. She shares her story about the support she got from finding Facebook groups on the internet. Another topic we discuss is the importance of acceptance and liking the new you after your diagnosis. Tena talks us through what motivates her, how having a Motability scooter is a great benefit to family life, and the impact of her health on her mental health. And there is so much more. Did I mention one of the key tips from Tena is to talk? And now let me introduce you to Tena Kennedy. Hello, Tena. It's lovely to have you on the show today. I'm so glad that you have joined us because you've got such an interesting story to share with everybody. So what I'd like to do is just start off with, can you introduce yourself to everybody and tell me a little bit about your life before your diagnosis?
Hello, everyone. My name's Tena Kennedy. My name is actually spelled Tena because when my dad went to register me, he was very dyslexic. In those days, the men had to go and do it. And he thought, cup of tea and put an N in it. And I've never minded until they named the incontinence wear. So I'm Tena, although it's got an E. When I was 49, I had my first cardiac incident. It turned out to be unstable angina. It was quite a bad attack, but I was allowed home to celebrate my 50th. And angina was still a problem. So GTM was my lifesaver. But I was very active. I was working at a rural GP surgery, and I was also a coordinator for the local first responder group.
So you had first-hand experience, didn't you, really?
Yeah, we used to carry oxygen. It's true. And to be honest, they so needed the help. But it's so rural, you know, sometimes they were miles and miles away. So somebody had to respond so that the patient was safe, if you know what I mean. But we carried a defibrillator and oxygen, amongst other things, in the great big red bag. I'm sure you've seen them hoy them over your shoulder like the weight of a small child. But they decided because of the angina that I couldn't carry it. So I wasn't allowed to be a coordinator anymore. I was great as a fundraiser. I'm not afraid of putting myself forward so I could make the money, but I was so sad that I couldn't do it. It was a big loss to me. But then it started to affect my work. I told you I worked in a GP surgery and a lovely group of people, but it's a huge loss when your health starts to affect your working life. You know, because it was affecting my working life, I had a patient list, and it meant that the other colleagues had to come and cover my patient list just because I was feeling unwell. And it got so unfair, I had to leave. And that was one of the worst things for me, was not having a working life anymore. It was really, really hard.
How did the angina get in the way of this? What did it feel like?
Because it was unstable, because I never knew when it was going to happen. And sometimes it wasn't just a case of putting the GTN under your tongue. It was knocking me off my feet sometimes, you know. And as I say, you never know when it's coming. If you get stressed about something, but there doesn't have to be a rhyme or reason to it. Fortunately now it is well controlled. I still have a GTN spray, but I don't have to use it too much. But it's there if I need it. But you know, I don't think there's any cure for it. I just think it's a problem that you have to learn to live with.
So you didn't actually have a heart attack. It started with
No,
angina.
not my first. They thought it was when I was admitted. They actually were treating it as that. They thought it was, until the results of my blood tests came back, and they said no, it wasn't a heart attack. I've never had a heart attack, fortunately. I think I've had everything else, but not that.
So you mentioned that you had to leave the job that you loved. What else changed in your life around that?
We decided to move back to Buckinghamshire, buy a new house and move down here nearer my kids. But fortunately for me, I was closer to the London hospital, so my actual healthcare changed a lot. It was a lot more intense, so it was a good thing.
Was it a deliberate move about the hospitals, or was it more about being with family?
Oh, family first. Family first. And when those things happen to you at that age, my dad had died at 58 and his brother at 61, and I was really concerned. Once they told me I had heart problems, I thought, you know, fortunately for me it hasn't happened and I've gone past that milestone. But it's very tragic watching your dad die at that age of heart problems, and his brother with a stroke at young ages. So when I moved to the specialist hospitals in London, that was something they decided to investigate because of the family history. So
yeah. So did you find that you got a lot more support being at a hospital like that? What did
I just think they're more specialist. I mean, the people at the local hospitals were really lovely, but they didn't have the knowledge that these people do, the knowledge of the drugs and the care. I felt really protected because I even now I adore the doctors and the nurses. I feel safe there. You know, they make you feel safe. Yeah, it is important. Yeah.
So how are things now? Has life improved for you, or?
Oh, sadly not. Everything's progressively getting worse. I've got aortic and mitral valve regurgitation that starts off as a mild thing and then goes a mild to moderate, and mine are unfortunately moderate to severe now. But my heart isn't in this sort of condition where they would like to intervene at the moment. Should it become an emergency, they will do it.
And how did they find that? Was it through an echocardiogram or?
Yeah, and lots of scans, an MRI scan and a TOE, which is a test where they put a pipe down and actually look at the heart from the other side. But yeah, they found out those things, and they found out I had a prolapse on the mitral valve as well. But things that you wouldn't ever know, and in days gone by, they wouldn't have been able to find out. But as I was telling you about my father dying early, they decided I'd got dilated cardiomyopathy. And it actually is genetic. It actually is passed down. So now they test my children for it, which is a good thing because, again, it makes you feel safer.
Was that a hard decision for you and your husband to have that conversation with the kids?
No, not at all. No. Always with my kids, honesty is the best policy. You know, they know mum's not right. They want to know what's happening. I never hide stuff from them, never. I think it would be the wrong thing to do, because if we did have a bad thing happen, they need to know what's going on. So sometimes they come up with some really good ideas of, you know, how to approach things slightly differently.
Yeah,
so it's just really good. But I also have atrial fibrillation, so I'm on blood thinners. So I look wonderful colours because I'm bruised everywhere. I have heart failure, tachycardia and SVT, which is supraventricular tachycardia. It's just a normal heartbeat, and sometimes it goes really, really abnormally fast. it can be treated with a drug called flecainide, or sometimes they have to do an ablation, which is done by putting a little tube into your artery in your groin and actually going up into the heart and lasering parts of the heart. But fortunately, I haven't got to that stage where I've had to have that done yet. I'm using the flecainide drug, but I'm hoping that we'll stay with that. I've also got a loop recorder implanted in my chest because I have cardiac syncopes. And a cardiac syncope is like a blackout or a faint, a collapse. I've had a couple in the house and injured myself when I'm here on my own. So they put a device into my chest, which is monitoring. It goes to a thing by my bedside, and each night they download the data, and I have a little clicker. So if anything happens that I feel is abnormal, I can click it and it will start to record that incident. The only thing is it doesn't actually stop you going down. So I now wear an alert around my neck as well that you press, which takes it straight to the phone line. I had to have something because I collapsed near my sink and also in my hallway. I knocked all my teeth back up in the gum and they were all broken. I had to have my teeth taken out and I injured my knee. And it's quite frightening when you know you've got these things. They told me not to have a shower when there was nobody in the home, and you start to think, oh, what would I do if I was in the shower? But like everything else, you soon get used to it. I'm not saying you get used to collapsing, but you soon get used to the care that's there and how to manage things yourself.
Yeah,
I think some of it is just the confidence.
Yes. I was going to say, it sounds like it's managing the fear, because I know from my experience, I was very, very fearful after my heart attack. Many things that really was quite surprising. And we take having a shower for granted, don't we? But
I think the more you go through these things, though, the more you start to realise that what you think is a big thing actually isn't. They give all these tests, all these super duper names. Usually it is just an abbreviation or a couple of letters, and you think, well, what is that? And it's your fear because you don't know what it is. And the thing is, whatever, don't go and Google it, for goodness sake. It's the worst thing to do. But I would try and find out what it is so that I try and make myself less scared. But the best way for me is, because I'm a member of support groups, I can ask people that have had like incidents that I've had in my life, and they can sometimes tell you, what it is or what it was for them without scaring you too much, and they're very supportive. I do use the internet a lot. Knowledge, it really is the knowledge, and these are people that are sensitive to how you're going to feel because they understand. So it is, having a little bit of knowledge does help, really does help. But you wouldn't ask them things to do with your own medical need or anything like that, because they couldn't tell you, but they would tell you for them how the situation addressed them. So at least you know what you're going to do or what it's going to be like. I find it much better. A little bit of knowledge is much better.
Yeah, and it sounds like communication is a really key thing about talking and
you know what I'm like with the talking. I mean, I believe that it is the essence of all of these things. If you talk to other people and if you share how you feel, it gets you through it, and it really does. Even if it's a down talk or an upbeat talk, you've got to. But I have the utmost faith in these people. So it's good for me. It works for me.
Good. That's good to hear, because I'm a great believer in talking. You keep it in, you're not processing it. And I think a lot of people feel vulnerable admitting how they're feeling. But actually, I think it makes you more bulletproof, because if you can put your hand up and say, I need help, or I just need somebody to listen, or for you to tell me your story, it kind of puts everything in perspective for you and you can cope better.
And I kind of feel also that if something starts off as a little thing, and if, like now, we're all isolated, it becomes so huge just because you're thinking and thinking and thinking. Whereas if you talk about it, you realise, hang on, that was only something small. But do you know what I mean? You get anxious, and I do think it's important to share.
It puts everything in proportion, doesn't it?
Yeah.
So there's a massive amount of things that you've just described to me about your health. is there anything else? But I hate to ask if there's anything else, but I understand that you also use a CPAP machine.
Yeah, I do. Sadly, I've got quite a few respiratory problems as well. I've got asthma. I've got small airway disease, long-term steroid use and antibiotic use. But I've got what's called bronchiectasis, which is a condition where your lungs, the airways become abnormally widened, which leaves you vulnerable to infection. And sometimes produces a lot of mucus. Fortunately for me, mine doesn't at the moment, but I do suffer. But a CPAP machine is just a small box that blows constant air at pressure through a hose to a mask, which is attached to your face. But it's nothing to be feared. You will get used to it. Believe me, I thought, oh, I can't do it. But you soon settle down to it. And honestly, it helps me so much. I'm now using it in the daytime as well as at night when I'm feeling really bad, and it does help me.
Does it help you get a better night's sleep as well?
Well, they usually use them for sleep apnea, and they did tell me that they thought I had a very small degree of sleep apnea, and they thought it would help with that. But I wouldn't say so, because I think the steroids ruin my night's sleep anyway. I'm on so many steroids that I'm bouncing off the ceiling sometimes. So no, not really. But I can read. I've got some glasses that have got nice flexible arms on. So I put it all on, put my mask on, and then I attach my glasses to the outside of it, so I can lay and read, or so that I can, go onto the iPad if I'm awake. Because obviously I've got a partner. I don't want to make noise or get out of bed. But it works. You can make it work. But for people that are being given them at the moment, I know how scary it was. I was scared of it. But it's just a tube and a mask, and you think, oh, the pressure's going to blow and I won't be able to swallow. Yes, you can. Yeah, yes, you can. So it's just a case of getting used to it.
Yeah, so it's a bit like feel the fear and do it anyway, and then reap the results and the benefits. So.
Yeah. I would tell anybody to have one if they suggest that they need one.
Good. So, guessing that you have many, many conversations with specialists and doctors and cardiologists, etc., have you got any tips about how to make the best out of those appointments?
Absolutely. If you're going in for something and you don't really understand what's happening to you and you've had tests, make your list of questions before you go to the hospital. If you go in armed with a list so you know what you want to say, usually they come in and they'll talk, but once he's finished, most of the doctors will give you a minute to talk. Ask them your questions, and if you don't understand the answers, please say to them, I'm sorry, I don't understand, so that they can repeat what they said. Also, you could ask them that all clinic letters, all outpatient letters, are CC'd to you. And the hospitals really don't mind doing that. So when you get home and you think, oh, what was that he said? I really can't remember. The letter will come through and you'll see it. They really don't mind doing it. And it's exactly the same letter that they send to your GP.
Excellent.
So you're getting all of the information on it. Yeah. But they would be my tips. I mean, to be honest, my consultants are my friends now. I wouldn't be without them, and I really like them. If you're uncomfortable with your doctor, you need to ask yourself why, and you need to look further than the white coat and realise that they're people too, because they will talk to you. They will.
And it's interesting you mentioned about the white coats, because we kind of feel slightly anxious when we're talking to them. We go to our appointments, don't we? And we're anxious anyway because we don't know what the outcomes are going to be. And then there's these people that are very clinical in the way, and we think that they know everything.
Yeah. And some people are taught to respect them, but it goes a little bit too far, so they're afraid of them. No, they're people. Have a look a little bit deeper, because they're people. And they're lovely. I mean, I love mine, as I said. They really, really look after you and will explain to you if you need their help.
Yeah. So another top tip would be make a friend of your doctors and cardiologists, eh?
Absolutely.
So, Tena, you've obviously had to make an awful lot of changes. You've mentioned how the steroids have affected your sleep, etc. What were the key ones that you had to make, do you think? And how have you found that?
Accepting I couldn't work was awful for me. I just couldn't get my head around that, and it was my way of socializing. I love people, I love being around people. It was really tough not being able to go to work. Also getting used to being slower and less able. My grandson will go tearing off and he'll say, "Come on, Nanny, run." And I think, oh, I'd love to run with you. Oh, but you have to learn your limits. You have to learn when to say no. And it's a hard lesson to learn. And also you have to learn when you need to ask for help. And that's hard to do because you want to prove to everyone that you're doing okay. But you soon learn that if you don't ask for the help, the next day you're going to be bad, and it's not worth it. You've got to ask someone to help you if you can't do things.
Mm-hmm.
But they would be my biggest ones, that I couldn't work, that I'm slower, and I fall asleep all the time. That's a big one.
Yeah,
I fall asleep all the time. Terrible. But you do get used to it.
Yeah, so it's about adapting for you, isn't it, to the changes?
Absolutely. Lots and lots of big changes in my life. I don't feel like me anymore, not the old me. So I just have to accept that I have to learn to like the new me.
Yeah, I think that's important. We are, after we've had a cardiac event or major heart issues, it's almost like we leave our lives as we were behind.
Yeah, I'm not the same person. Yeah.
No, I definitely aren't. I hope you agree. I like myself. I love myself who I am now, but it was quite a shock going through it.
Yeah, I was going to say I do now. It took me a long time, and it took other people's support to make me realise that. But I'm there now, and I do like this me. And when I see the kids, the joy that the grandkids, I mean, obviously not now because of shutdown, but the joy of the grandkids coming running up. I can't stand and sweep them up anymore, but if I sit down, I can still do exactly the same. You have to learn to adapt your life. But no, I love life. I want to live my life to its fullest at the moment. I want to get out of it what I can while I can. So
that's excellent.
Want to enjoy it.
Yeah, great mindset to have. So what is it that motivates you to have that thought process?
My family, my kids, my grandkids. Oh, 100% my grandkids. My kids, but it sounds like they're little children. My kids are adults, and I do have grandchildren. Oh, and I adore them, absolutely adore them. But they motivate me. I want to be nanny that can do things. I use a Motability scooter. Right. And when we could go away on holiday, we went away only for a weekend. And I said to them, "Come on, kids." And we went off down the promenade with their money to go to the fair. And I could sit on the top and actually just watch where they were on the rides. And it was lovely. And I felt like I'd got them on my own again, if you know what I mean. Yeah. I mean, it sounds like the oldest one was about 15 then, and the youngest one was about 6. So, it's not as if I was having tiny ones that I wasn't with, but it was lovely for me. It was lovely.
Sorry, I was going to say your Motability scooter is kind of giving you another lease of life that allows you to. Absolutely. We've got a dog, and the grandkids love going to walk the dog. My son goes with my husband to walk the dogs, and I think I want to go. But now I've got the scooter, I can go. It's not because I can't walk, it's because I can't breathe. Yeah. I can't walk very far at all. I can't, if I'm honest. But it's the cards that you dealt with. So I'm quite happy to get on my little scooter and off I go. Yeah. The grandchildren say, "Get off, Nanny, I'll have a go." I say, "Oh, no, you won't." I can imagine them fighting over having a go when you're not sitting on it. "I'll have a go." I said, No, it's mine. So, I mean, it's lovely to hear you talk about your family and how happy they make you, and also about the fact that you have adjusted your view on life to be able to carry on living and enjoying it to your best ability. Because I think if we get stuck in that, life's never going to be the same again, we actually are quite defeated in ourselves. I'll be honest, I had been there. I had low moments. I have, but I was going to ask a while ago. Yeah, I was going to say, did your health issues cause like an issue with your mental health, and did you get any support? Absolutely. I went to talking therapies a couple of times.
encouraged by the GP and my medical team. And I was very skeptical, but I have to say that it was very useful that they knew what they were talking about, and it gave me a little bit of encouragement to be a bit braver than I was. I do take antidepressants, and I'm certainly not ashamed of that either. I do think I need them. Although I'm a glass half full person, sometimes some of the things get quite heavy to bear, so I like to take them. But I was very lucky. I met a lady online called Gail Pittman, and I was at my lowest, and she saved me. She saved me from myself. She saved me from wallowing down that path, and made me see that I wasn't alone. I felt so alone at that time. You never have any contact with other sufferers, or how do you get that contact? But she, from the internet, she gave me so much courage to get out and do things, and she was an inspirational lady, she was, but she helped me. She asked me to join internet groups and things like that. I joined Bell's Hearties, and I also joined another marvelous group, which isn't gender specific, they're groups for everyone. So please have a look on the internet. If you're feeling really low and you want an ear, and you don't have anyone around you that you can talk to about what you're feeling, there's so many help groups out there that really will help you. Lovely people. Go seeking, and don't be afraid to talk. They know what you're talking about. They've been there, so they understand.
Yeah. So it was Facebook groups that really started me on my journey, because I felt so alone. And like you've just said about your relationship with Gail, meeting her, being able to hear that there's other people that are better off, worse off, different to how you are with your health issues, kind of does give you the courage and the confidence that you aren't alone in this.
No. I mean, now I rely on Bell's Hearties is always there for me. That's my weapon of choice. But there's lots of others. There's lots of others, but they are really lovely with me. And sadly, we haven't got Gail with us anymore. She had a heart transplant, but unfortunately got quite sick afterwards, and she's not with us. But there was another lady called Julie Bartlett, and really, really lovely, but there's nothing you can do. Nothing you can do about it, because they fought their battle and sadly lost. So,
and it's for us to carry on living life,
absolutely,
making the most of it, because we don't know, do we?
Gail put me back on the road that I'm on now. She did, and I try and do it for other people, because it's so important. Really is so important.
And that's kind of the purpose of my podcast. I want people, whilst it's us having the conversation, it's for other people to listen and to learn, and to know that there are other people that are feeling and experiencing very similar things.
Absolutely. Just somebody to lean on a little bit.
Absolutely. And it goes back to your earlier point about the communication and talking and sharing, etc.
Yeah.
But on that note, if I was to say to you, have you got some top tips that you could share with people that are listening today to help them in their heart journey?
Well, my top tip would be a glass half full. Gail taught me that, and it makes life so much nicer to live. Like you said, don't sit there being woe is me. You've got to try and get above it and think, we can do this. Let's do this. Talk lots. It's very therapeutic, makes you realise you're not alone, but it also makes you feel better. If you can talk to people and smile, it's really nice to have a caring ear. It is, that you can go to people who understand you and know how you're feeling. So I would always say, glass half full, go and talk to somebody and never give up. You're all stronger than you think. There's always help. Always stronger than you think. There's always help out there, always, but you have to go find it. And if you're lucky enough to find a Gail, then you'll be fine.
She sounds like she was a marvellous lady, and she really
Oh,
helped you immensely.
wonderful, wonderful, wonderful lady. And she got that gift of life, and it's so sad that she didn't get to live her life. But she was a lovely, lovely lady. I wish you'd have met her. You'd have had her on. You'd have had her on your podcast if you'd have met her.
Oh,
Lovely.
that's good to hear. So, have you got anything? I've asked you lots of questions. Is there anything else that you'd like to share with us today?
I've got lots of other illnesses, unfortunately, as well as my heart problems and my respiratory problems. I do have lots of other problems. And again, I think it's about your mental health, and it's about how you live your life with it. I mean, I try to live a busy family life. It sounds silly, but I used to get upset because I couldn't do my own ironing. You've always been the mum.
Can I just interrupt you? Why would anyone want to be upset about not doing the ironing?
Do you know something? I've never liked it. Never liked it. Never. When I was working full time, I used to pay somebody to come and do it. But I just used to get so upset because I felt that I was not running my own home anymore. And I'm sure for the men, they probably feel they were the wage earner and everything, and they're not doing it anymore. It's a big impact, but you've got to see past it. Like you said, what does it matter if you don't do the ironing? What does it matter if you're not the wage earner? Just turn your lives around, steer it around so that it's good how you're doing it now. You're inside your own front door. It doesn't matter what other people think. It's what works for you and what keeps you most healthy.
One of the things listening to you today that comes across to me is about how you have adapted and changed your expectations through the changes that have happened to you. And you sound so powerful, and yet I also know that you feel really vulnerable because it's a bit of a mix, isn't it?
Yeah, the illnesses make me vulnerable. But you have to, if you lose the positivity, then you're not going to get through it. So I think, the illnesses definitely, and believe me, I have my down times too, but all those girls in my support group would be able to tell you about, because I'm lucky enough to be able to share it. I think if you bottled it up, it would be awful. But no, I'm good. I like life. I like people. I can't wait for this COVID to go away so we can all be back outside and, living probably not a normal life anymore, but, doing what we can and making the most of it. I can't wait to get out.
Do you have a particular goal of what you're looking forward to doing the most?
Well, I want to go on holiday again with the kids and the grandkids. We've already booked somewhere with fingers crossed right for the end of the year. But it depends if we're allowed, and it depends how well I am. I'm not allowed to fly, so we can't go on a an aeroplane off to somewhere sunny. So we're going to have to rely on good old blighty weather.
Yes, well, let's keep our fingers crossed that because we've all been shut down for so long, we have a glorious summer like we did this year.
Oh, yeah, wouldn't it be lovely? Yeah, it would be lovely. But as I say, my goal is that it's to try and get healthy enough to be able to enjoy every minute of it with the kids, and that would do me lovely. Yeah.
So it just really leaves me to say this has been a marvellous interview with you. Thank you very much for having the time with me. I will link to the Bell's Hearties group that you've mentioned, and I think it's Pumping Marvellous, was it?
Yes, it is. Yep.
So I'll link to them in the show notes that go with this interview. And I'm sure that many people that are listening to the show will probably pop along and join the group and find out a lot more about how they can get support and help. So Tena, you're definitely not a Tena. You're a Tena. I got that.
No, not a Tena. Well, if you want me to, Sally, I will send you a photograph of myself in the CPAP mask. I do apologise to people because it's not my best look, but again, it could allay people's fears.
That would,
if they see it. Yeah, I'm quite happy to do that. As I say, you won't see my best side, but it just eradicates. People usually say, "Oh, what does it look like?"
Yeah,
I'll show you. I'll show you.
Seeing it often actually, it gets rid of all fears, doesn't it? I think I said earlier, sometimes it's the thought of something that is fearful. The actual doing is not.
We laugh about it. My husband and I laugh about it. I can't tell you what he calls me, but he sings me a song.
Well, I think on that note.
Yes. Thanks, Sally.
All right, lovely. Thank you very much.
Thank you.
You've been listening to Sally Crawley and the My Heart and Mind podcast, a show for you if you've had a heart attack, cardiac event, or other life-changing experience and want to feel good. It's all about mastering your feelings and emotions so you can feel great and live the life you love. To find out more, visit www.myheartandmind.co.uk and note that that's an AND and not the ampersand character. Go be magnificent.